If you're over 50, I want you to think about something for a moment. Not your age, not your testosterone, not even your erections. I want you to think about your prostate. Because here's a fact most men were never told clearly. A simple, natural habit that many men still do quietly is strongly linked to lower prostate cancer risk as men age. And no, this is not about medication. It's not about supplements. It's not about extreme routines. It's about ejaculation frequency. Large long-term research following tens of thousands of men found that those with regular monthly ejaculation had a significantly lower risk of prostate cancer compared to men with very low frequency. This doesn't mean it prevents cancer, but it does mean your daily habits matter more than you think. And after 50, they matter even more. I'm Dr. Mika Hayashi, a urologist with over a decade of experience helping men protect their prostate and sexual health as they age. Today, I'll explain what the research actually shows, what's normal after 50, and the mistakes that quietly cause problems. Stay with me, because this information could change how you care for your body. For most men, prostate problems don't start with cancer. They start quietly. You wake up once at night to urinate, then twice. The stream feels weaker. You stand there longer, waiting. Nothing hurts. Nothing feels urgent. So you ignore it. By age 60, about half of all men have some degree of prostate enlargement. By 80, that number is close to 90%. Yet most men still believe one dangerous myth: that's just aging. Nothing I can do. That belief is what causes trouble. Your prostate is not a passive organ. It responds to inflammation. It responds to hormones. And it responds to use. What many men don't realize is this: when ejaculation becomes rare, prostate fluid can stagnate. That stagnation is associated with higher inflammation markers. And long-term inflammation is one of the key risk environments for prostate disease. This is why researchers started paying attention to ejaculation frequency. Not because of pleasure, not because of morality, but because of biology. In long-term population studies following men for over a decade, researchers noticed a clear pattern. Men with very low ejaculation frequency had higher prostate cancer diagnoses later in life than men with moderate, regular frequency. This relationship stayed consistent even after adjusting for age, lifestyle, and other health factors. Now, let me be very clear. This does not mean ejaculation prevents cancer, and it does not replace screenings, PSA tests, or doctor visits. But it does mean prostate health is influenced by daily habits. And here's where silence hurts men the most. Many men over 50 stop sexual activity not because they want to, but because of fatigue, stress, partner illness, shame, or fear of decline. Some feel embarrassed talking about it. Some think it's not appropriate anymore. Some were raised to believe it's unhealthy or wrong. As a urologist, I can tell you this clearly. The prostate does not care about shame. It responds to physiology. Men who completely stop ejaculation for long periods often experience increased pelvic discomfort, more urinary pressure, higher anxiety around sexual function, faster decline in erectile response. This is not weakness. It's biology. And the worst part? Most men never hear this explained calmly, scientifically, and without judgment. So let me ask you something, and be honest with yourself. Has anyone ever explained this to you before? If this is the first time you're hearing it explained clearly, type 1 in the comments. Because in the next section, I'll explain what the research suggests about healthy frequency after 50 and where most men misunderstand it completely. This is the question every man wants answered. How often is normal? How often is healthy? And when does it become a problem? The research doesn't talk about daily behavior. It talks about monthly patterns. In the largest long-term studies, the strongest prostate benefit appeared in men who averaged around 20 to 21 ejaculations per month. That's not every day. That's not extreme. It comes out to roughly 4 to 5 times per week. Some weeks more, some weeks less. What matters is the average over time, not perfection. And here's an important detail most men miss. This number includes all ejaculation, partnered sex, solo stimulation, even spontaneous nighttime release. Your prostate doesn't distinguish between them. It responds to movement and clearance. Now let me clear up a dangerous misunderstanding. More is not always better. The protective association seems to plateau around that 20 to 21 range. Going far beyond it does not add extra protection. And in some men, excessive frequency can lead to irritation, fatigue, or performance anxiety. This is where balance matters. For men over 50 who are single, widowed, divorced, or whose partner has health limitations, solo activity becomes an important part of maintaining prostate and sexual function. That is not a failure. That is not replacement. It is health maintenance. For men in relationships, this does not mean replacing intimacy with your partner. In fact, many couples find that when pressure is reduced and health is the focus, intimacy improves rather than declines. I've had patients tell me they felt guilty masturbating a few times per week, even in loving marriages. They thought something was wrong with them. Once they understood the biology, the guilt disappeared. They stopped seeing it as a secret habit and started seeing it as part of staying healthy. And here's something else that matters after 50. Consistency beats intensity. 1 month of high frequency followed by long periods of nothing does not provide the same support as steady, moderate regularity. Your prostate responds best to routine, not extremes. If you're a man over 50 and no one has ever explained this without embarrassment or judgment, this channel is built for you. Subscribe now, because in the next section I'm going to cover the critical mistakes men make during solo activity after 50, mistakes that quietly cause irritation, inflammation, and long-term problems. And most men have no idea they're making them. Here's what most men don't realize. It's not just how often you ejaculate that matters. It's how your body is treated during the process. After 50, small mistakes add up. And over time, they can lead to irritation, inflammation, and avoidable sexual problems. Let me walk you through the most common ones I see as a urologist. Mistake number 1, ignoring friction. As men age, skin becomes thinner and less elastic. What felt fine at 30 can cause microirritation at 55. Repeated friction without proper lubrication can lead to local inflammation, sensitivity, loss, discomfort. After ejaculation, this is not about pleasure. It's about protecting tissue. Gentle contact and adequate lubrication reduce irritation and help maintain healthy nerve response. Mistake number 2, using excessive pressure. Some men notice reduced sensitivity with age. Their instinct is to compensate by squeezing harder. That creates a vicious cycle. More pressure, more nerve irritation, less sensitivity, even more pressure. Over time, this can dull natural response and increase recovery time. After 50, lighter stimulation and variety work with your nervous system, not against it. Mistake number 3, rushing. This one surprises a lot of men. Quick, rushed ejaculation often leads to incomplete muscular contraction in the pelvic floor. That means less effective prostate fluid clearance. More residual tension afterward, less relaxation response. Taking your time allows a more complete physiological response, which is where the health benefit comes from. Mistake number 4, ignoring warning signs. Pain, burning, blood and semen, persistent pelvic pressure. These are not normal aging. They can indicate prostatitis, infection, or urinary tract issues that need evaluation. Ignoring them only makes recovery harder later. Mistake number 5, turning it into an escape instead of a routine. When solo activity becomes the only way to cope with stress, loneliness, or anxiety, it can drift into imbalance. This isn't about shame. It's about awareness. Healthy behavior supports your life. Unhealthy patterns quietly replace it. I treated a man in his early 60s who developed chronic pelvic discomfort. The cause wasn't frequency. It was irritation from poor technique and rushing, combined with stress. Once he slowed down, protected tissue, and paid attention to feedback, his symptoms resolved within weeks. The lesson is simple. After 50, your body gives feedback faster. Listening early prevents long-term problems. In the next section, I'll explain something many men never expect, how this habit affects sleep, stress, and emotional stability in powerful ways, and why ignoring that connection costs men years of quality life. Most men think this topic is only about sex. It's not. After 50, it's just as much about your nervous system. When ejaculation occurs, your body releases a very specific chemical sequence. Dopamine gives a sense of relief and reward. Oxytocin promotes calm and emotional grounding. Endorphins reduce pain perception. And prolactin signals your brain that it's safe to relax. This is why many men naturally feel sleepy afterward. And this matters more than you realize. Men over 50 are far more likely to struggle with light, fragmented sleep. Waking up too early racing, thoughts at night, chronic low-level anxiety, what many don't realize is that sexual release is one of the body's built-in stress regulators. When it's removed completely, stress hormones like cortisol stay elevated longer. That affects sleep depth, blood pressure, inflammation, even insulin sensitivity. Several studies show that men who maintain regular sexual activity report better sleep quality and faster sleep onset. Not because of exhaustion, but because the nervous system finally gets a stand-down signal. I've worked with men who tried everything for sleep: magnesium, melatonin, breathing exercises. Nothing worked consistently. When we address stress release and body rhythm, including healthy sexual routine, sleep improved without medication. And there's another piece men rarely talk about: emotional regulation. After 50, life stress changes. Work identity shifts. Parents age. Children leave. Health becomes uncertain. Men aren't taught to process this emotionally, so it shows up as tension. Regular release helps prevent emotional pressure from turning into irritability, withdrawal, or numbness. This is not weakness. It's maintenance. Men who completely suppress sexual release often report increased agitation, lower patience, reduced motivation, a vague sense of flatness. Your brain needs regular reset points. And healthy sexual release is one of them. If this is making sense so far, hit the like button. It helps more men over 50 find information they were never taught without shame or fear. In the next section, I'll explain something critical: how regular ejaculation helps preserve erectile function as you age, and why long periods of inactivity quietly accelerate decline. Stay with me. This is where many men get caught off guard. They think erectile decline just happens, that it's age, that it's hormones, that it's inevitable. But the truth is more uncomfortable and more hopeful. Erectile function is use-dependent. An erection is not just arousal. It's a vascular event. Blood must flow in. Tissue must expand. Nerves must signal. Muscle must relax. When this process happens regularly, the system stays responsive. When it doesn't, changes begin quietly. Blood vessels lose elasticity. Oxygen delivery drops. Erectile tissue becomes less flexible. Over time, this leads to weaker response, shorter duration, and slower recovery. This is why men who stop all sexual activity for long periods often experience faster erectile decline, even if their hormones are normal. Regular ejaculation helps maintain penile blood flow, vascular elasticity, nerve signaling, pelvic floor coordination. Think of it like joint movement. If you stop using a joint, stiffness sets in. If you move it gently and regularly, function lasts longer. This is not about performance. It's about preservation. For men without partners due to illness, distance, divorce, or widowhood, solo activity becomes especially important. Not emotionally. Physiologically. I treated a man in his early 60s whose wife had serious medical issues. Out of respect, he stopped all sexual activity for over a year. When intimacy later became possible again, he couldn't maintain an erection. Nothing was wrong with him. The system had simply gone unused. We slowly reintroduced regular stimulation to restore blood flow. Within months, function improved significantly without medication. This is why I say this clearly to my patients: stopping completely does not protect you. It accelerates decline. Now let me be equally clear. This does not mean you should push through pain, fatigue, or emotional distress. Healthy activity supports function. Forced or anxious activity does the opposite. The goal is regular, calm, pressure-free stimulation. Not performance. Not proving anything. Just maintenance. Men who understand this early tend to age with better erectile response, less fear around intimacy, more confidence in their body, and confidence matters more than most men admit. In the final section, I'll address two things most men never hear from a doctor: the guilt many men carry quietly, and the clear signs that mean it's time to seek professional help. Stay with me. There's one more thing we need to talk about. And for many men, this is the hardest part: guilt. A lot of men over 50 were raised to believe that solo sexual activity was shameful, unhealthy, or something to grow out of. So even when they do it, they carry quiet stress afterward. Let me be very clear with you. From a medical standpoint, there is no evidence that healthy, moderate masturbation harms men over 50. None. What the evidence does show is that regular ejaculation is associated with better prostate health, better sleep, better stress regulation. Better preservation of erectile function. Shame does not protect your health. Silence does not protect your prostate. Understanding does. Now, balance matters. While this is a healthy behavior for most men, there are clear situations where professional help is important. You should talk to a doctor if you experience persistent pain, burning, or blood ejaculation becomes difficult or suddenly stops, urinary symptoms worsen quickly, sexual behavior feels compulsive or out of control, solo activity completely replaces emotional or physical connection with your partner. These are not failures. They're signals. And signals deserve attention, not embarrassment. Let me summarize what matters most for you. After 50, regular ejaculation supports prostate health around 20 to 21 times per month appears to be the beneficial range. Technique should be gentle, unhurried, and protective. Consistency matters more than intensity. Sexual activity supports sleep, stress balance, and erectile preservation. Your age does not make this less important. It makes it more important. You deserve honest information about your body, not outdated myths. If this video clarified something you've wondered about but never felt comfortable asking, subscribe to this channel. This space exists for men over 50 who want clear, respectful, science-based guidance. If you're comfortable, comment below and tell me what part of this surprised you the most. And remember, this video is for educational purposes only. It is not medical advice. Always talk to your own doctor or urologist about your personal health. I'm Dr. Mika Hayashi. Your prostate health matters. Your confidence matters. And you're not alone in this stage of life. Take care of your body and treat it with the respect it deserves.